Okay.
Any questions?
At an earlier press briefing a few weeks ago, I indicated that within a month's time, the Prime Minister would be making a full statement on the way forward with St. Jude and what would be happening. The Prime Minister is presently out of state, but as soon as he is back on island, a full statement would be made on the matters relating to St. Jude. But in brief, I can highlight some of the things that have transpired since our last press briefing. We have done a number of assessments. The final report from the audit report came in. There is a document coming up to Cabinet this morning for decisions on this matter. Once that decision has gone through the Cabinet process, further details would be released to the public on this matter. A few of the things that we have been able to identify with St. Jude would have to do with the new plan moving forward. And while I can give very preliminary information on it, whatever is going to happen with St. Jude is going to happen on the existing site. We have resolved that the problems that are going to be addressed will be addressed using the existing St. Jude site. We have also agreed that based on the information available, now that we've done all of the assessment in terms of the design brief for the hospital, the as-built drawings that are there, that a few of the buildings on the St. Jude site can be used, and greater details will be given on which components of the buildings can be used to be incorporated in the new plan for St. Jude moving forward. We expect that the completed brief would be ready and that the Prime Minister would make the full statement on it. But what is clear is that we are going to use the existing site, that some of the buildings will be used, others that cannot be used for the actual layout of the hospital. We will look at other means or other purposes for which they can be used. I think that should help allay a lot of the concerns of people that substantial amounts of contributions had been given by corporate citizens, by St. Lucians, and a number of other interests, both in and out of St. Lucia, towards this hospital project. And that is one of the reasons why as a government, we went back and forth a lot of times to make a determination, because it was never our intention to abandon the St. Jude site. We were always exploring all of the options that were available, and we did promise the people of St. Lucia that we would be making the best decision possible so that we could facilitate as much of what the public would be happy with, as much as meeting the needs of the health sector. So it is the responsibility of the government to strike the proper balance between what had been done and how much of it that can be used. This in no way changes the fact that we are proceeding with further investigations on what transpired at St. Jude, and that those who have to be held accountable will be held accountable. I know that the preliminary report of the audit, not the technical audit, but the financial audit of St. Jude, that is in the process. I know that from the preliminary report, there are clear indications that there's a lot to be concerned about in terms of the expenditures on the hospital project and what transpired. A lot more information will be disclosed when the Prime Minister gives a full address as to what is going to happen. But we expect that with the designs that are being done now and with the as-built drawings that are there, because the as-built drawings had to measure every square foot of space at St. Jude, every wall that was built, every wire that was run, every single thing is involved in the as-built drawings. So what we have are clear indications as to what is to be changed, and what is going to be used. So as a government, we feel that we are in a much more comfortable position to make a decision and to make a good decision moving forward. It is not about just reacting to pressure or to what is being said. At the end of the day, if anything goes wrong with this project, when it is under our watch, we are the ones going to be held accountable and responsible. Everybody would tell us, you are supposed to fix the problem because that is why we elected you, and that is exactly what we are working to accomplish. On the other aspect of the health sector and what is happening, we've had a lot of discussions. There's a lot going on in the media in terms of the privatization of OKEU. The government position is not to privatize OKEU. I think privatization usually sends the wrong signal, or when you hear the word, people interpret it in different ways. So what we are going into is a joint venture arrangement where the government will always own the OKEU hospital. It will always remain the property of the government and the people of St. Lucia. In terms of the operational side of the OKEU hospital, this is where we are exploring. And as we have said, no agreement has been entered into. No agreement has been signed, and you would hear a lot going on. There's more than one company who have indicated interest in the joint venture with the government for the operations of the OKEU hospital. And in the coming weeks, I am sure that some of these companies, you would be aware of who they are and what their proposals are in relation to what is going to happen at OKEU. The government also gave an undertaking that we are going to provide or establish a national health insurance. Now, I know some people are questioning whether the government can actually deliver on what it promised. By April 1st, or the beginning of the new financial year 2019, we expect that everything would be in place for this new health insurance plan. We have been engaged in discussions with a number of insurance companies. Some of them have actually sent quotations to the government in relation to the cost of coverage for health insurance for the entire 170,000 people of the population. I know that there are some people who would not be happy that the government of the United Workers' Party would be able to accomplish this. But I am confident that the government will be able to deliver on that promise. And that is why our structure is designed in a way that we can give all of the information that is required, that everybody would be clear on what coverage they are getting, everybody would be clear who the government would be responsible to pay for, and who would be making their own contribution to their insurance. There are a number of St. Lucians already with health insurance. We have no intentions of interfering with people who have their own health insurance coverage. But for those who cannot afford, and healthcare is something that is very sensitive. And I believe that all politicians on both sides of the house have been fully exposed to the issue of the cost of healthcare insurance because of the number of constituents who face all of us, whether in government or in opposition. The most frequent request that comes to a politician is the request for assistance for healthcare. I think we have to get ourselves to the stage where as a country we can provide more affordable healthcare for the nation. And one way of doing this is to provide the health insurance. The health insurance will have limitations. But these limitations we are going to discuss, and in my discussions with the Prime Minister, we are going to have a series of consultations with various stakeholders, with the population, with the various communities. In fact, one of the things I intend to do, representing the second largest constituency on the island, and population-wise also the second highest population in the constituency, I intend to start very early my discussions with my constituents on healthcare insurance. So those who want to criticize the government plan for healthcare insurance, it is up to them. But I am convinced that the plans that I have seen is going to revolutionize what is happening in the health sector. So if the government decides to go the way of the joint venture, what is going to happen is people would not have to worry about how they're going to pay their health bills. But remember, all health insurance have limitations. So if I were to just put out a figure to you now based on what we have, we are expecting that each St. Lucian, if that is the final agreed negotiation, would have an average of 100,000 EC dollars of health insurance coverage for the year. So it means that if you go to the hospital, and it is not going to be limited to going to the government hospital. If you choose to go to a private hospital like Tapia, and even your private doctor visits and specialists, some of this will be covered by the insurance. So we are putting it out there that as a government, we are committed to this plan. And I know why the opposition is making all the noise that they are making. They are fully aware of what the plans of the government is on the health sector. And they know that by the time this plan materializes and people begin to see the benefits of what is happening, that they are going to have a very tough time convincing the people otherwise. So now you see a lot of misinformation out there, a lot of intention to destabilize the country and create chaos. But the government is resolute and determined. And I am one of the ministers working along with the Prime Minister and the Minister of Health because of my involvement in the Ministry of Economic Development. It is part of the team that is putting together the health plan, how it is going to materialize, and the insurance plan. And I want to assure the people of St. Lucia, this is not a cheap political game that we are playing. We have given ourselves timelines. So we expect all the legislation to come to Parliament before December. The Attorney General's chambers would be presenting all of the documentation, all of the laws that need to be changed to facilitate that process. And I am sure the opposition will have ample time in the Parliament of St. Lucia to have the discussion and the debate on the health care plan of this government of the United Workers' Party. We have been promised universal health care from way back when the Labour Party came into office. Have they ever delivered on that? But they want us to believe that we cannot do it. They want to tell the people of St. Lucia that we cannot deliver. But I know that every promise we have made as a government, we have been able to deliver on it. And we have not given ourselves 4 and 5 years to determine whether we can deliver. We said give us up to April next year. And you would begin to see the realization of health insurance. We may choose to run a pilot project, and we may choose 40,000 people to roll out the health insurance plan and see how it works. Or we may be in a position where we can roll out the entire health insurance plan for the whole island. Now, I want the people of St. Lucia to pay attention to this. This is not for the politicians. This is for the average St. Lucian who cannot afford to spend $1,000 at the doctor. Imagine that the government is paying health insurance for you, and you are covered to the tune of $100,000 for the year. That is where the discussion is going on healthcare insurance. And I've had some chat with members opposite. They are aware of some of the plans that we have. They know that this plan is coming to reality. So as an opposition party, they are determined to destabilize this country before this is realized. But I know that the people of St. Lucia know better. And the people of St. Lucia will work with this government to realize healthcare insurance. So if the hospital goes into a joint venture arrangement and a third party is running the operations of the hospital, the question is, how will the people of St. Lucia be able to afford health care? Well, the health insurance. Tell me how many St. Lucians today can afford health care insurance of $100,000 for the year. Tell me how many of our population can afford that. So imagine if when we establish, not if, when we establish this healthcare insurance, it means that you have that coverage for the year. Now, some people may use the entire coverage in 6 months. It means that for the other 6 months, they would have to make up for the balance of their healthcare. But it is a much better position to be in than where we are today. Now, that is going to be the basic plan presented by the government. It means that anybody who can afford can put add-on to it. So you can say, okay, the government is giving coverage for that first amount. This is the rate at which it is coming. And the Prime Minister indicated that the government will pay for the poor, the unemployed, the indigent, the elderly, and people who are below a certain income bracket. The government will take the responsibility to pay for these people. Now you may be asking us, where is the government going to take the money to do so? If we do not have the burden of running the hospital, and that the hospital is going to generate finances from the insurance company, then some of the same funds that are used to run the operations of the hospital today can now be used to pay the insurance premium for some of the people that the government will have to pay for. So I want you to be very clear in terms of where we are going, what our plans are, and I am convinced that we are going to deliver on this promise to the people of St. Lucia.
Questions? Anyone?
Those who already have insurance, the government will not be interfering with them. Does that mean that they will not be part of this, or what are you saying of this, the 100,000?
I have my own health insurance already. So my health insurance coverage is more than what is going to be covered by the government. I've been fixed at a particular rate with my insurance company because of the number of years that I've been there. I will not want to give up that health insurance coverage to become part of that plan. So I would not be a burden on the government to be able to meet any payment of my premium because I've been paying my premium. People within a certain income bracket would have to make their own contributions towards the health insurance. So let's understand something. One of the proposals that came from the team that was charged with the responsibility of getting OKEU operational was that the government should add the 5% contribution on insurance, the NIC contribution. The proposal was increase that by 5%, where the employee would pay 2.5% and the government or the employer would contribute the other 2.5%. We would have raised in the region of $55 million from that venture. But that $55 million would just go towards the operations of the hospital, because the preliminary numbers for OKEU, apart from what was being spent in the health sector already, was an additional $70 million plus. So when we raise the 55, government would need to add another $15 million on this. On this $15 million, that is just for government to continue to run the hospital. That would be paying no medical bills, no insurance, nothing for anybody. So everybody who went to the hospital for a doctor's visit would still be required to pay. We are saying, if we add that 5% and we let that 55 million at, let's say, an average of $1,000 insurance premium for the year. You know how many people that's paying for? 55. That 55 million will pay health insurance for 55,000 people in St. Lucia, giving them $100,000 insurance coverage for the year. Now, I don't know how much simpler we can put this. So what the government is saying, rather than us taking the burden of running the hospital and not running it up to the standard that is required, because it's a fact that we are afraid of facing. Most of the serious cases we have, people want to go to Martinique, they want to go to Barbados, they want to go to Venezuela, they want to go to Trinidad, we go to Miami, we go to all other places to see doctors. It is obvious that our health facilities and our health care is not up to the level that we would really like it to be. So part of the arrangement in place is that it is better for us to have health insurance and let the insurance pay for the running of the hospital, so that in that way we can get much better health care coverage and we can have a higher quality of health output. The problem is not with the quality of the doctors that we have or the quality of our nurses. Our nurses are top-notch nurses anywhere you go in the world. They can match to any standard. But look at the facilities and the conditions under which they have to work. So what we are saying is that we need to upgrade. The upgrading is not just in the facility, but it's in the financing that is required to run these facilities adequately. And that is why one of the strong components the government is focused on is the component of medical tourism, where this would help to offset some of the cost for specialized services. And that's what most of the world-class hospitals, that's what they do. Can you imagine when a St. Lucian go to Matnik, what their contribution is towards the hospital in Matnik, or whether we go to Miami or any other place? So the reality is there are different components that we are building into what is there that would help to offset the cost of operations of the hospital. So in essence, medical tourism would do some cross-subsidy of our health sector in St. Lucia.
Thank you, Minister. Do you want me to do a copy of your statement for that?
No, that's all.